Potentially 40 deaths, so that's understandably a very grim prediction. How serious are these predictions?
Well, this prediction is based on the average statistics of people who unfortunately die after being infected in a nursing home. Now, obviously, health authorities will be doing everything that they can to make sure that that number is less. But I think what the government was saying is when you get that level of infection in a nursing home with people who are already often significantly health compromised, then the rate at which people will die will be higher than in the general community. That's why it is so essential that everything possible is done to make sure that COVID-19 doesn't get into nursing homes. And that's what the package of measures that you referred to that were announced over the weekend, with the federal government providing significant additional support into the nursing home sector in Victoria. That's why that's so important and so welcome.
Let's go through some of these initiatives. Funding will be used to help aged care facilities ensure that staff do not work across multiple centres or homes. Is this a good step? And are you concerned in particular about this practice of workers moving between different facilities?
This has been a concern that we've had and that providers have had for some time. Unfortunately, in Australia, we don't currently have a aged care worker registration scheme. The government has flagged that it's moving in that direction, and certainly the Royal Commission, which is continuing to work hard, is moving in that direction. But individual homes can work out with their staff that they're only working in one place, so there's financial support for that. There's also financial support to ensure that if people are doing the right thing, they've got a sniffle, they don't go to work, they call in and say they're ill, that there's additional staff provided. And then a range of other measures designed to increase the infection control.
Do you think that some homes should be locked down with staff inside until this second wave is over?
Look, I think that would depend on medical advice about that. Certainly the term lockdown, which has been used particularly to prevent visitors coming in, and which certainly there'll be much more restricted visitor arrangements at the moment, with arrangements for compassionate exemptions to that. But certainly that term lockdown has never applied to staff. I think that it's really critical, as I've been saying for weeks now, that providers understand and implement that every staff member, every shift, is reminded, is checked and monitored and reminded of how you go about infection control, and trained to know that every interaction they have with every resident is a separate potential infection episode. Now, this is something that's at a level that's not necessarily that they're used to in nursing homes, although they have to have infection control regimes to protect against the flu, to protect against gastro outbreaks spreading. But it's really important. This is a highly infectious disease, and it needs to be taken to the ultra level in terms of training, support and monitoring. Absolutely.
And Greg Hunt has also said that aged care is now at the front line of the response. Given the situation in Victoria, where there has been a number of facilities with active cases for the past 5 days or so, do you think that this has now come too little too late, that we needed this extra funding months ago?
Well, some elements of this have been there all along. What I think is really important is that aged care providers put their hands up and ask for help if they need help. This is not a time to say, I want to avoid the scrutiny of the Aged Care Quality and Safety Commission or the department. If they have any doubts, then they ask the government for extra help. There's not a time to be being brave about this. So there's been a great deal of government support, and these measures are stepped up from measures that are already in place. Certainly aged care is at the forefront. This is a global phenomenon. We've seen really appalling death rates in some other countries, and although the situation in Victoria is obviously of grave concern, we've not seen that kind of situation here in Australia. Obviously, as well, might I just say to all your viewers, that the best way to stop COVID-19 entering nursing homes is to reduce community transmission. That means following very carefully the medical advice about your own infection control so you don't become a spreader. Because if you're a spreader, then in fact it can get into a nursing home near you. If there's no COVID in the community, there won't be COVID in nursing homes. So let's get it down in the community.
Some really great advice there. Just finally, obviously, it's also a very difficult time for loved ones who do have people in these nursing homes, in the aged care facilities. Do you think, though, that increased visitation restrictions should be back on the agenda in the interim?
Well, certainly increased visiting restrictions are already in place, and the Victorian Department has flagged additional ones. They are now working. We've been communicating with them about what I would call the compassionate exemptions. Things like when someone is dying, that arrangements are made for them to have family present. Things like that the person with dementia who's had a family member coming every day who helps them with extended feeding or with their behavioural issues or mental health issues, if they're part of that extended care, that needs to be continued to be facilitated. And it can be, because it's no more difficult than making sure your staff are doing the right thing. And family members are willing to do any measure to do that. But as a general rule, we as a community have to accept that there will be visitor restrictions in a normal case. What we do need to see is aged care providers establishing good communication with families and establishing other ways of communicating between residents and families other than direct face-to-face visits. But, you know, it is quite possible to run a good visitor infection control program. If you can't run it for visitors, I don't have confidence in being able to run it for your staff.